and welcome to Health Talk. I'm your host, Allison Rainey, and we have guest Victor Chen. Victor, thank you for joining us today.
Thank you.
Victor is a graduate of UC San Diego, a human biology major, and very interested in our topic today, pharmacogenetics and personalized medicine. So Victor, what is pharmacogenetics?
Well, first off, I'd like to thank you again for having me on the show. Pharmacogenetics is really exciting, and it's a topic that I'm really passionate about. Pharmacogenetics is the study of how genes in our genetic makeup interact with the medicines that we take. So you and I have very different genetic makeups, obviously, and depending on the types of drugs that we take, they can act differently in our body. So pharmacogenetics can be divided into three different categories. So we have pharmacokinetics, basically what happens to a drug as it's going to the target site. Pharmacodynamics, what happens once that drug reaches the target site. And idiosyncratic drug reactions, which is unforeseeable drug reactions, and those have huge implications for patient safety. So some people, for example, will take a drug and unbeknownst to them, they might have an immune reaction which is adversely affects patient safety. But I guess first we want to talk about the history of pharmacogenetics. So pharmacogenetics started more or less with Pythagoras, the Greek mathematician, who noted that certain individuals would eat foods such as fava beans and have, illness. This was actually confirmed in the 1950s when some physicians found that people lacking an enzyme called glucose 6-phosphate dehydrogenase would essentially also have these adverse reactions to these foods. So I think that patient safety and studies like that are basically very interesting for the home audience.
Yeah, definitely. Well, thank you for that. So in terms of personalized medicine, we hear a lot about that now. I know there's a big company out there, 23andMe, but can you help me understand what exactly do they do, or what does personalized medicine mean?
So personalized medicine, also some people refer to it as precision medicine, is basically the study of how we can tailor medical treatments for each individual that walks in the clinic. Previously, drugs were made as kind of a one-size-fits-all model. You have a drug on the market, and the drug companies assumed that it would work the same way in everybody, but in fact that's not the case. So we're trying to move towards a way so that we can effectively dose people or figure out what's safe for different individuals based on their genetic makeup. And you had mentioned 23andMe, which is a biotech company. And they do direct-to-consumer genetic testing, and that was very exciting when they first started it. People were able to do a little cheek swab and send it in, and they would get information about their ancestry and different genetic diseases. So that's really exciting.
Great. So when you mentioned a little bit about the history, but when did this really come into play, or when did pharmacogenetics, personalized medicine, start getting on physicians and people's radar?
So the Human Genome Project was the first real foray into personalized medicine and precision medicine. So it started in 1990, and it finally completed in 2003. So the first genome sequence actually took 13 years, and it cost the government and centers worldwide about $2.7 billion to sequence the first genome. And you can imagine that that was a huge undertaking by scientists. But now it's become much, much more affordable. In the years since, there have been many advances in gene sequencing technology, and we can see that a genome now costs around $1,000, and hopefully in the next couple of years it will become even more affordable and more available, importantly, to people around the US and around the world.
Oh, wow, it's incredible. My ticket to the Super Bowl costs more. So
I know.
That's surprisingly affordable. So can anyone go and have this testing done, or what's the process if I was interested in having pharmacogenetics testing done? How would I go about that?
So right now there are very few direct-to-consumer testing programs. Like 23andMe is direct-to-consumer. They mail you a little kit, you swab your cheek, and then you mail it back. Most pharmacogenetic testing is done through a prescription by a doctor, mainly because you want to discuss with the physician based on what types of medicines you're taking, and what that genetic test actually means. So genetic information is actually very interesting in that it tells you a lot about yourself, and it also raises a lot of other questions about your health in the future. So it's very important that you consult your physician when you're getting genetic tests, especially for pharmacogenetics, for genetic diseases and things like that.
Mm-hmm. All right, so it sounds like really positive. I mean, I would be interested in getting to know my genetic makeup. Are there any downsides? I mean, I'd be a little concerned if I'm susceptible to certain diseases, or, are there any concerns out there with the negatives of pharmacogenetics?
Yes. Like I said before, genes. So your genetic makeup doesn't really change over your life. You are who you are once you're conceived and you're born. So if you, for example, test for a certain gene and you find that you have a variant that, for example, will increase your risk to, say, breast cancer, colon cancer, something like that, some people may not want to know that, and other people, the science is still a little out on very large multifactorial diseases such as, the cancers that I mentioned, or say diabetes or heart attack, or cardiac risk factors. So it's very difficult to interpret how your genes, in addition to your environment, will affect how you will contract these diseases. So a lot of the available genetic testing is only for very well characterized diseases. It's a very, I would say, cut and dry. And also for pharmacogenetics, and in that standpoint, there is the Clinical Pharmacogenetics Implementation Consortium, and they have a list of around 100 drugs that have been very well characterized, but a lot of the other drugs are still in studies. Yeah.
And where could I go have this done? Can I go to any physician or any hospital?
So most physicians, you would have to consult with your physician to see if they have that available. But most companies will be able to take a prescription from a doctor, and that's through your doctor's office.
And are there any big companies out there, or any industries that are doing pharmacogenetics?
Yeah, so there are a couple big players. So GeneLex and Millennium Health. I'm not associated with either one of them, and nor am I necessarily endorsing them, but they're two pretty big players, and they're also they're not direct to consumer. They're through your doctor's office.
Oh, okay.
Yeah.
And then in terms of, so let's say that once this information we have, our genetic makeup or what diseases we're susceptible to, how will the doctor be able to tailor that medicine to better help the patient's health?
Well, that's a great question. So a lot of the pharmacogenetic testing that we have available is for this protein called cytochrome P450. And basically, that's a protein that's in your liver, and it's very, very important in breaking down drugs. And so it has a different effect on different drugs. For example, codeine, which is something that is a painkiller that some of the viewers at home might have heard of, some people aren't able to metabolize that as fast. So it doesn't have the same narcotic effect as it would in a normal person. So that one's relatively well characterized, and your doctor, or the anesthesiologist in this case, would be able to tailor it or treat you slightly differently, give you a different pain medication, something that would be more effective. So in that case, yeah. So other big name drugs that have pharmacogenetic testing available that are relatively well characterized, there's certain blood thinners like Plavix, and warfarin is also another big one that has pharmacogenetic implications.
So in your opinion, when do you think this became really relevant, or when did because obviously 50 years ago we look back, this obviously wasn't the way medicine was practiced. So was there anything in particular which sparked scientists or doctors to pursue pharmacogenetics, or what was kind of what took place that there was a revolution in this?
So I think it's always been there. Like you said, it started in the 50s. We were able to kind of see that in families there would be certain diseases, that would be passed down from generation to generation, and from a genetic disease standpoint. And like I said before, there are some families that would have adverse reactions to narcotics or have adverse reactions to foods. But really, it was in the 1990s once we started the Human Genome Project, after we completed the Human Genome Project in 2003, and right now we're on the cusp of just being able to get it out to everybody. The cost of genome sequencing has plummeted. People are learning more about it. People are excited. We're gathering more and more data on people's genomes as it becomes cheaper. Like I said, the first one took 13 years and $2.7 billion. Now there's a machine out there that can do it in a matter of a couple days. And right now it's what we do with all of that data. A whole human genome actually sequenced in tiny, tiny print will take up an entire bookcase that's about 6 feet tall. So it's a ton of information. And really it's what we do with that information right now, and sorting through all of that.
So if I were to go have pharmacogenetics done, and let's say I'm a little worried, we talked about maybe I find out I'm susceptible or I have certain characteristics, what would be the biggest benefit to me as a patient to having this testing done?
Well, in my opinion, I think patient safety is number one. I mean, personalized medicine and precision medicine is great for improving outcomes, but patient safety and being able to see those adverse drug effects before they actually happen. So an adverse drug reaction, if you take too much of a painkiller, for example, that's kind of an extension of the painkiller drug itself. You become, you're not able to come out of it. But for example, an idiosyncratic drug reaction is something that most doctors can't foresee. It's usually an immune reaction where your body will react to it. And so there's actually an HIV drug where they recommend testing prior to taking it because they've seen these reactions before. So patient safety is number one. Number two would be efficacious dosing. So like I said before, there are some anticoagulants on the market such as Plavix or warfarin, where pharmacogenetics will play a huge role in how that drug is metabolized or broken down in the body, and how that actually will affect you. So if you're too sensitive to the warfarin, then you become prone to bleeding, and that's obviously not good. And if you're insensitive, then you're still at risk for clots. So we want to find that happy medium so that we can get our patients the best treatment.
That's fascinating. So do you think with all these advancements and data coming out that people might have hypersensitivities to certain drugs or intolerant, that maybe a birth of new drug classes could come about for these specific patients that...
Exactly like you said. So there's a lot of these studies, like I said, they're still coming up. The science is still relatively new. And there aren't that many in terms of the number of drugs that we have. What they call clinically actionable pharmacogenetic tests. So we're still trying to figure out which drugs we can actually take action on, like the efficacious dosing for warfarin, and versus we're still doing studies on other drugs. And the studies for other drugs where people are non-responding or non-responders, they're looking at their genetic sequences to see if there's another way we can target that particular pathway, to see if there's something else that might be beneficial to those patients. So definitely it's a topic of consideration.
It is very interesting. So are the drug companies out there, I mean, there's a plethora of companies out there that bring drugs to market. Are they in collaboration with the companies you mentioned that do pharmacogenetics? Are they helping them, or are they just totally separate, or what's kind of their involvement?
So I am not entirely sure on, each particular company will probably have their own collaboration. I know that there's some companies that will have already, invested in the gene sequencing technology, and they're using it to, tailor treatments for, different people who are non-responders. And we always talk about, how hopefully with more of these available, it will bring down the cost of gene sequencing and, direct-to-consumer and pharmacogenetic testing and things like that. This is maybe a little speculation, but just your opinion. Right now we're at about, you said $1,000. $1,000, yeah.
How soon do you think it will be maybe a couple $100 or something affordable to the patient? How close are we to that point?
A couple $100. Actually, the $1,000 genome was it was kind of the finish, not the finish line, I would say, but it was a really big benchmark in the gene sequencing world. A lot of companies were really competing to hit that $1,000 mark. I don't know how much cheaper it can get. We'll see how it goes, but I'm really excited to see in the next, 10, 15 years, even in the next 5 years, how much cheaper things will get and how much more available, these types of tests will be for patients. So it's really exciting to see.
And and as we live in this kind of ever-changing healthcare world, and insurances are changing, would this be something insurance would cover for the patient if they were interested in getting this testing, or is this an out-of-pocket cost?
So that's really interesting. I think the industry is trying to push for insurance to cover this sort of information. Of course, this information is really sensitive. Some people, like I had mentioned before, if you're at risk for certain diseases, it's may potentially affect the insurance cost, right? If your insurance pays for your gene sequencing, and they find out that you're at risk for a cancer down the road, would that play a role in gene sequencing? That's one of the big questions that we have to face. So certain insurance companies may say, oh, you have this risk factor for this disease, therefore down the line you'll cost us more.
Kind of opens Pandora's box.
It
a
really
little
does
bit.
almost. But like I said, there's certain diseases like diabetes that aren't well characterized. There's certain genes that will say, oh, it'll increase your risk for this disease. But what does that actually mean in a tangible? Will I get it in 10 years? Will it be 15? Will it be 20? What if I stick to a very good diet and I exercise? So it's very multifactorial. So I can't say for sure.
Well, thank you. So we've learned a lot today about what pharmacogenetics is and what personalized medicine. Thank you for sharing the history. For the viewers at home, if you had to just give a couple take-home messages or what's most important to remember from our topic today of pharmacogenetics, what would you sum up the summary to be?
So I think that pharmacogenetics is a really exciting topic. From 1990 to 2003, we had the Human Genome Project, and since 2003, genome sequencing has only gotten more affordable, more widely available, and it's something that we look forward to in the future, so that we can tailor medicine for each of our patients. I think that it's going to be it's going to play a huge role in the future in patient safety, preventing adverse drug reactions, and also play a huge role in efficacious dosing, so that we make sure that our patients have the best possible outcomes in their treatment. So those are the two big takeaways, I think.
Well, great. Well,
if you have any questions, of course you want to talk to your physician about pharmacogenetic testing. If you want more information, there's the National Library of Medicine, which offers a huge number of resources. Genetics Home Reference it's put together by the National Library of Medicine and the National Institutes of Health, and they basically offer a lot of reading information on genetics and different genes and how your body will respond to different medicines. So for our more biologically inclined viewers at home, you can also check out the Clinical Pharmacogenetics Implementation Consortium, and they have guidelines for physicians and clinical practitioners for how each gene will actually play a role in the management of different diseases and how they affect each medication.
And are there any certain, we've talked a lot about pharmacogenetics, but are there any certain like races or people from different parts of the world that are more susceptible to certain diseases? Would pharmacogenetics test that?
Oh, yes. So in terms of pharmacogenetics, I just want to be clear. Pharmacogenetics, pharma for drug or pharmacy, and genetics for the heritability part. So there's the pharmacogenetics. So certain, we've seen that that cytochrome P450 protein that I was talking about previously, the one in the liver that breaks down a lot of the drugs that we take. There's different variants of that, and they're specific for different ethnicities. But depending on the drug, they'll interact differently. So we've seen that a lot of the drug studies that come out of the U.S. have had Caucasian test subjects, so they'll interact very differently in, say, African Americans, Hispanics, Asian Americans. So sensitivities for all those drugs are very important to consider.
Has there been any studies done as races continue to mix and interracial marriage becomes widely common and almost the norm, that susceptibility or maybe sensitivities to certain drugs are diluted, or is that something that hasn't been studied?
That's actually really interesting, and I haven't actually looked at, I don't know if there's been any studies on that, but I'm sure that there will still be variability within the population, simply because there will always be genetic variation in the population and how drugs affect different people. But that's something that I'm looking forward to reading about in the future, and that's definitely an interesting point.
Well, it's interesting. So obviously, you've become kind of an expert on this, or really taken an interest. Are there any websites or books or studies, journals that you would recommend reading, or where did you learn about all this information?
Yeah, so like I said before, the National Institutes of Health put together, after the Human Genome Project, for the lay audience, there's Genetics Home Reference, and that's really tailored for somebody who doesn't have a whole lot of biology experience or reading studies or primary literature, as they call it. And that's a great place for people to start if they want to learn about, what's a cell, what's a gene, what's a protein, how does it affect my body, what are different genetic diseases that, we've studied and really understand really well. Or if, you're on the news and they say, oh, we found a new gene for, such and such disease, you can actually type that gene right in Genetics Home Reference, and they have, a description of what the gene does in your body and, what known variants there are. From there, you can always go to PubMed. PubMed has, all the new studies that are coming out, and it's very exciting to, field that's growing very, very rapidly. And those are two very, large, and I don't think I could get through it myself. But I've spent a long time on those, and they're very interesting.
What would you say that you've obviously learned quite a bit and shared with me? What's kind of been the most fascinating thing or interesting thing to you that you've learned?
So I think the reason that I'm so drawn to this subject is that it's really going to make a difference in the future. We're getting to this point where gene sequencing is becoming so cheap, and it can really transform how we practice medicine. Drugs before, like I said, were one size fits all, and we kind of threw it at the patient, or well, not threw, but we gave it to the patient and said, this should help, and if they didn't respond, we would switch them to another drug, or switch them to another treatment. But what's exciting is that if we can test them ahead of time, and we can say, oh, you're not going to respond to drug A, so we'll start you on drug B immediately. Or even more exciting is that, there's certain cancers, for example, where there's a specific mutation, and we know of a drug that treats that specific mutation. We don't have to go through the litany of drugs and finally find the one that's efficacious. We can go, we can sequence that, we can find the drug, and we can match them together, and hopefully we give that person the best outcome. So I think that's why I'm so drawn to it, and that's the most interesting thing. This isn't really pharmacogenetics, but very closely related to genetics is. So cancers are basically cells that are out of control in your body, and there's certain genes that get upregulated or downregulated, and so they can sequence a tumor genome, and they can sequence your genome and see where the variation lies and find that variant, and hopefully have a drug out there that can treat it. So that's one thing that I think is very exciting, and it's something that I think it's just amazing.
That's very fascinating. So it sounds like with the advancement of pharmacogenetics testing and personalized medicine, we'll be able to know ahead of time if the drug will work and just save the patient's family a lot of time. So
yeah, a lot of time, and a lot of people are talking about the cost of healthcare now, hopefully a lot of cost. It's obviously multifactorial, but anything that helps, right? So if we can get this kind of legwork done ahead of time, hopefully we can get targeted treatments for everybody.
No, it sounds very exciting with the advancement of technology in healthcare. Everyone wants, tailored specifically to them. It looks like we're on the brink of almost being there. So,
for genomics and gene sequencing, like you said, we're at this point where the technology is really fascinating, and I think that it's everybody's a little. So there's been a couple barriers to implementation, right? People are kind of afraid of gene. I guess the very classic. Example of terrifying gene manipulation would be Jurassic Park, right? You find the DNA from a dinosaur, and somehow we have dinosaurs running around the world. But I think gene sequencing in medicine is really exciting, but like you said, there are certain drawbacks. So we were talking about before how genetic information is very different from any other health information, because genes are so central to who you are as a person, and so different risk factors. There's been a lot of studies, for example, how if people know that they're predisposed to certain genetic diseases, they'll lead their lives differently. Or people will worry about them. So there's always that kind of ethical dilemma with these types of tests. So that's something which is why it's so important to talk to your physician. And all of this technology is so new. So we really want to try and establish guidelines around it so that we can really figure it out.
Yeah. So, is anyone? You mentioned kind of there are some people could be concerned.
Yes.
With some moral issues there. Is there anyone that's brought up maybe like replicating these genes or anything to do with if you have this information, what you could do with that?
So a lot of people are concerned with privacy, understandably so. There's there's a big company in San Diego that the CEO actually released his genome so that people could read through it, and people could manipulate it with their software, and people could use his test genome as kind of a playground, and they could run their algorithms on it. But he had actually redacted sections of his genome that he thought might be sensitive. So like you said, people are concerned about how much you actually know about this person's health, whether or not he's predisposed for certain diseases and things like that.
Very interesting. So I think we're just about running out of time here. So again, we talked about a lot today, and appreciate your enthusiasm you've shared with us, and I know I learned a lot. But just the last take-home message for the viewer at home, what would you say is the best thing out of pharmacogenetics that we're going to get from it?
So the best things from gene sequencing, personalized medicine, precision medicine, patient safety number one. I mean, I feel like that's the biggest one. We can, and also good patient outcomes. We can hopefully, tailor medications for different people, make sure that they're on the right medications, and make sure that they don't have any bad adverse drug reactions. If you want to read more, there's plenty of literature out there. The National Institutes of Health, like I said before, Genetics Home Reference, and PubMed, if you want to read the nitty-gritty, all of the science, all of the studies that are coming out now.
Well, great. Well, thank you so much, Victor.
Thank you. I appreciate it.
I enjoyed having you, and it was a wealth of information. And thank you for the viewers at home.
Thank you.